different from all aspects. Even talks में भी scenario आ जाता है, ठीक है? So initially I'm going to start with like a scenario. It's like a case. We're going to discuss that, and then we will go to exactly 20 years of age. खुशाब से था, and he was MH में he was admitted, and what were the presenting complaints? What did he come with to the hospital? Initially जो था, he went to Kotli. This was on the 16th of September, and he basically came with the complaints of vomiting, जो कि 3 days से थी, along with and lethargy. Appetite lethargy was 2 weeks. ठीक है? In the emergency, he was managed thinking कि patient dehydrated है, vomiting कर रहा है, and he's all lethargic. So what they did was कि they gave him IV fluids, IV antibiotics भी दे दी थी, IV PPIs दे दिए थे, and that's how he was managed. ठीक है? Now, थोड़ी सी history of presenting complaints क्या थी? He came with vomiting and fatigue, basically complaint थी उसकी. जो vomiting थी उसके 8 to 10 episodes per day थे. That vomiting was not headache, vertigo, altered mental status, and IV antiemetics, so that vomiting actually subsided. Along with that, the patient also had loss of appetite, lethargy for 2 weeks. He was not giving any history of respiratory tract infection. ठीक है? Now, uski jo past history, personal, family, drug history, everything was कोई significant. There was nothing. He was edematous. His hemoglobin was 11.2. His creatinine was a 4, and his urinary showed when he went to MH, वहाँ पे they did his vitals. They did some baseline investigations. ठीक है, this is इतना अच्छा clear नहीं है, but I'll just show you the main ones. As you can see, his creatinine is a 929. Now, this is a person who's never had any renal abnormality prior to this episode. His urea was a 24, which should have been roughly 7.1 millimole tak hota hai. So this is a 24. So he was in renal failure. Uremic symptoms all those को नहीं थे. यूरिन आरी जो था, यूरिन आउटपुट उसका थोड़ा सा कम था. एग्जैक्ट नहीं मुझे, आई डोंट रिमेंबर, बट इट वाज लेस. ही वाज अ बिट एडेमेटस. हिज यूरिन वाज पेल. उसके अंदर एज यू कैन सी प्रोटीन्स थी. यू कैन सी द 2 positives, एंड आरबीसीज जो थे दे वर न्यूमरस. अच्छा, देन नेक्स्ट जो है हिज हीमोग्लोबिन, एज यू कैन सी इट वाज 11.8, and other than that platelets were 179. बाकी चीजें nothing more significant in this. Next, stop सुनिए, next करें. अच्छा, so then some investigations were done in MH, जिसमें they did blood gases. There was acidosis, 7.27 pH, 27 pH था. Albumin ठीक था, it was a 36 mg per liter. Spot urine PCR 31, 24-hour urinary protein की थी, which was a 2.1 gram per day. Next. Even that was जितनी भी लैब्स आपको नजर आ रही हैं, फास्टिंग ब्लड शुगर, LFT, CRP, यूरिन CS, dysmorphic RBCs, ये सारे नेगेटिव थे पेशेंट के. Hep B, C, HIV, everything was negative. So what they did was MH में they admitted him, इसको dialyze किया patient को. He underwent 4 sessions in next 5. साथ में what they did was they gave him methylpred, ठीक है, नहीं of the methylpred that was given. 5 dialysis session के बाद मजीद dialysis patient की नहीं हुई थी. Then he was given the methylpred and then these labs were repeated. इसमें जो cret था that sort of improved to 533, जो कि initially you remember 900 something था. Urea improved as well. Potassium was still high, 5.6. His hemoglobin was 11.2. And that urinary was also repeated. उसमें वही protein was coming +2 and his RBCs were numerous as well. Okay. Because patient की nephritic picture आ रही थी, there were also negative. Next, Dr. Sunil, his C3, C4 was normal as well. Anti-DSTNA negative था, बाकी सारी labs were negative.